So I've had a run of clients this week and many others in my years of clinical practice who've experienced something in their interactions with the medical system termed medical hexing. So I've come across this term medical hexing before, predominantly in my research on the nocebo effect, which I've posted about before, and is essentially the opposite of the placebo effect, in that if you are primarily focused on and believe that you will experience negative symptoms and side effects from a treatment, it's very likely that you will. So this same mind-body power that can heal you can also harm you, all depending on what underlying perceptions and beliefs you hold going into a treatment. So there have even been studies where patients who have been told that they're terminally ill and have died within the given time frame given to them by their doctor, and it turned out that on autopsy findings they never actually had the disease that they were diagnosed with, and there was no physiological explanations for their death. It's an incredible demonstration of the reality of the physical consequences of our beliefs and our expectations and our perceptions of what we're experiencing. So the term medical hexing is really referencing the fact that words are like spells. They have immense power, and the doctor-patient communication interaction can have considerable consequences, both positive or negative, on treatment outcomes. So if you are sitting with a doctor, or any healthcare practitioner for that matter, and they are telling you that these labels, symptoms, diagnoses are incurable, that they're genetic and predetermined, so there's not much you can do about it, that you need to be medicated for the rest of your life, that relapses are expected and you're just going to be stuck with it and have to deal with them ongoingly, you're essentially being hexed, just like in voodoo. So words have biological consequences, and if you don't believe you can get better, as you've been told you can't, then you won't. So it's instilling in your conscious and subconscious mind a belief that you won't ever get well, and that the body isn't self-regenerating and isn't self-healing, and this becomes a self-fulfilling prophecy. So I see this every week, where clients working with me are really unwell and they're really stressed out, and they say that they've been told by their doctor, whether they've got IBS or SIBO or depression and anxiety, insomnia or chronic pain, that they're just going to have to manage it for the rest of their life, and medication is the only answer, and that it's probably due to their genetics. So this is an extremely common occurrence for people within the medical system, and underneath it all, I don't believe it's intentional of doctors or other practitioners to keep people sick and keep them arrested in their illness and their diagnostic label. It's just the way that they've been trained to disseminate and deliver information, and it's informed by their own beliefs around illness and disease and the possibility or impossibility of remission of certain illnesses. So anyone who's up to date with research on placebo, nocebo, epigenetics, psycho-neuro-immunology is mindful of the power of words and the reality that one, if not the most influential factor in reversing illness and restoring the body's homeostasis, is the belief that that's possible, because our beliefs literally switch genes on and off. So a lot of clients, when I'm with them in clinic, ask me if I think they can get better again, which I do. I believe everyone can. But I always flip the question back on them. Do you believe you can get out of this? Because what you believe about the possibility of being healthy and vital and reversing illness and becoming who you want to become is the most important factor. So I find myself saying to a lot of my clients who've been quote-unquote hexed and are kind of freaking out about what they've been told about their trajectory for the rest of their life with their illness, to let go of this idea that it's all in their genes and They're set for a lifelong ongoing struggle with their disease. And this is why, regardless of the disease label, that to heal anything in the body requires sending a signal of safety to our nervous system as regularly as we can, and trusting and believing that it can restore itself back to balance, which is an ongoing lifelong practice.